I'll never have my breasts back. A reconstruction will do nothing for me, and it might make things worse actually, because I've had some complications pop up this year with the grafts. I have to cover them up with bandages, or else they'll I don't know what's going on with them. I tried to consult my surgeon about it, and he didn't really investigate. He gave me advice that made the complications worse even, and actually temporarily gave me an infection, but I have to bandage up every day so that it doesn't like leak all over my clothing. I still have issues with my urinary tract. I have to use the restroom pretty frequently, and I didn't even know that this was possible. This is like a pretty huge quality of life issue that I'm experiencing, and I'm just not really getting any help for it. And on top of that, I do hate to speak about it, but I'm experiencing sexual dysfunction at the age of 18. That's something that women usually go through when they're in their 40s to 50s. How is I supposed to know?
So I just got diagnosed with vaginal stenosis. If you're confused, hi, I'm Zaya. I'm transgender, and like 8 months ago, I got bottom surgery, or gender confirmation surgery. So I had a PP, and now I have a vagina. And let me just preface this by saying I do not regret getting surgery. I do not regret it. So I don't want any of y'all conservative ass bitches to twist my words. I do not fucking regret surgery. However, I knew recovery was gonna be hard, but nobody tells you that it could be this fucking hard. But yeah, I was diagnosed with vaginal stenosis, and if you don't know what that is, it's basically when scar tissue gets built up inside of the vaginal canal to the point where it's like extremely tight and uncomfortable. And the thing is, for the first year after getting bottom surgery, you have to dilate your vagina religiously, because it's a brand new canal that needs to be kept open religiously for the first year. And now that I have this stenosis, I physically cannot dilate. My vagina still has depth, but it's so tight to the point that it could start to close and form pockets that could lead to infection, which means that I have to get another surgery. I basically just have to get the surgery all over again and get my vagina replaced, and like, it's just so fucking annoying. And it just sucks because my vagina has made me so happy, happier than I've ever been. I finally feel comfortable in my body. It's so pretty on the outside. It's just the inside of it that's all fucked up. And now I have to get an emergency revision surgery. I'm still waiting on the date. Hopefully it's soon. Yeah, I just wanted to come on here and be open and honest, because I hope this shows you guys that being transgender, I would never choose this lifestyle. I did not choose to struggle like this. All of the struggles that I've been through and am still going through are just to feel comfortable with my fucking self, to feel comfortable in my fucking body. And it's so hard. It's so fucking hard. But I would do this shit all over again if I had to. I would do it all over again. But yeah, bottom surgery is not for the weak, babe. It's not for the weak. But at the end of the day, I know that I can get through it. I know it's all going to be worth it in the end. No matter how much pain I have to go through, it'll all be worth it just to be comfortable with myself. Yeah, I'll keep y'all updated. Hopefully I get scheduled for my surgery soon. But yeah, thanks for watching.
I 100% feel like I was part of some cruel medical and social experiment.
I've now been living as a woman for 28 years, and I fully regret this.
I can't believe this happened. I ruined my life.
I'm angry. What's gonna happen to the kids and the youth? I'm sad for humanity and the children and what's gonna happen.
Wish I could just very harshly say to my young pre-testosterone but trans-identifying self, don't do any of this, don't go on T, don't get surgery, don't even change your name, just stop.
I lived 8 years as Laura Jensen until I woke up and realized that it was totally insane to live this out.
Those who are struggling with their gender. This is called gender dysphoria, where they feel a particular way that doesn't line up with their physical reality. And so the technical term is gender dysphoria. And some would say that you should have a transition to match your felt reality, at least in your mind, to match your physical reality. And so gender dysphoria is that confusion, and then they are trying to seek ways to remedy that from their perspective. All right, so now that we've defined our terms, how many people are really struggling with this? Well, according to numerous statistics, the numbers are exploding in recent years. As one example, we'll take a look here at a clinic in the UK called the Tavistock Gender Identity Clinic for Children and Young People, and they've seen just a surge in referrals in the last 10 years, in the last decade or so. And these numbers are similar throughout the Western world, including here in America.
This is what I mean. This is how deep my voice is. It's gotten deeper over time, and it's settled. This is what I mean by hair loss, and it just keeps getting worse. It keeps thinning. It keeps receding backward.
My name is Chloe Cole, and I am an 18-year-old former transgender child. I transitioned from the age of 12 up until 16 when I realized it all was a lie. My story is a cautionary tale. Children and parents across the country have been caught off guard by gender ideology. How did we get to this point?
One of the examples that I'll often give is eye contact. When I try to introduce the concept of what's neurodiversity affirming, what does that mean? The response that sometimes I'll get is like, well, you can teach the child to like look at somebody's nose or look at somebody's forehead or their ear or whatever. I'm like, no, that's just teaching them to mask. That's not neurodiversity affirming. Now, I do think there's value to helping kids or whoever understand, like, there might be times where people are expecting this. So how can you make the choice either to self-advocate or to just not worry about it? Or, you know, if you do choose to mask, how do you weigh out the benefits versus the drawbacks for you personally in those situations? My preference would be like to give somebody the tools to say, you know what? It's much easier for me to focus on you when I'm not watching you speak. And so I might look at the floor, but please know that I'm still listening, rather than trying to teach them to conform. Like, what difference does it make?
Hi, my name is Dr. Jeremiah. I'm one of the family physicians running Mana Doctor Clinic at Citygate. So gender affirming healthcare is a broad principle which refers to healthcare that is administered in an affirming and inclusive way to gender diverse people. And this refers to the entire structure of the healthcare, not just the clinic, but in terms of the bigger healthcare system. I guess, for example, in my clinic, what gender affirming healthcare means is that when a gender diverse patient comes into my clinic, they automatically feel welcomed, with the staff not assuming their gender or their preferred name. We make sure we get their preferred names and refer to them through the entire process. So through the registration, when we call them into the consult room, and when the doctor addresses them, we have things like our staff wear name tags with preferred pronouns, so that gender diverse people know that this is a safe place. So we have this kind of like small signs around the clinic to show that we're an affirming place.
At the age of 2, she was already telling us, I'm not a boy, I'm a girl. You'd be like, oh, you're such a cute little boy. Nope, I'm not a boy, I'm a girl. She was struggling a lot with tantrums. They thought it was sensory processing disorder. And then when she was 4.5, she went to the gender clinic at Lurie Children's Hospital in Chicago. And, you know, the doctor sat down and said, are you a girl? And she said, yep. And he's like, okay, from now on, you're a girl. And it was like a light switch. It went from this really hard toddler trying to get her to navigate the world and put on clothes and tantruming to the easiest kid ever.
Do you remember when you realized you were a girl?
No. That you have now, looking back on that, is it traumatizing to think about?
Absolutely. It's horrifying. This shouldn't have been an option for me. It hurts knowing, like, I could have just grown up without any intervention, and I could have been completely normal. I wouldn't be dealing with all the stuff that I am now. I'm having some pretty serious complications from my surgery, on top of all the trauma that it's caused me. If somebody just told me, like, this isn't going to make you into a boy, and there's no guarantee that doing any of this is going to resolve your distress. You're perfect as you are as a woman. The issue isn't your body. It's
the way that you think of it. And no matter what you do to yourself, what drugs you take, what surgeries you get, you're always going to be a woman, and you are enough. I wouldn't be dealing with any of this right now.
Did anyone say that to you?
I love this question, and I've talked about this on my page before, but I am very pro robotic affirming. Not only is it quick and easy, like you can choose 1 to 3, however many affirmations, and repeating them nonstop. You don't have to do anything besides repeating them in your head. Not only is it quick, it prevents you from thinking the opposite. If you're telling yourself things like, I'm a money magnet, I'm a money magnet, I'm a money magnet, your mind physically won't have time to think like, I'm broke, where's my money at, blah, blah, blah. And in essence, affirmations are new wanted thoughts. It's not a technique. I've talked about that also before. Affirmations are you thinking the new thoughts as if you were to have your desire right now. So by you repeating those thoughts, that's what saturates your mind. The repetition is what saturates your mind and kills the resistance and kills off the old story.